welcoming you for MDS Microbiology NEET 2025 Predictor series. Okay, still we have 30 seconds to open the window. Now the time is exactly 7:59. See carefully. Everything is okay. Audio, video, everything is okay. Audio, video, everything is okay. I'll check. Just a minute. Just comment in the chat box. Audio, video, everything is okay. Just a minute. I'm not able to see. Yeah, fine. Everything is fine. Cool. Right. So, now listen to me carefully. We are classifying. I classified the class into three areas. One is what we learned from the past. That is called previous year questions. PYQ. That is learn from the past. Previous year questions. Few questions we'll see. We have some questions. Based on that, you can learn what they are going to ask. What kind of pattern, what kind of toughness, at least how many questions we are having. All these things we can get from this PYQ. I'm not going to anything new today teach. This today is fully strategy and questions. Number two, based on that, we are going to predict some areas. Okay, predictor. Prediction. So PYQ means lessons learned, predictor, possibilities. So based on that, what we are going to see in the future, in the present we'll plan. That is called predictor. And third, very, very important, key topics to cover. Last minute, key topics, key titles. Definitely we may get a question. 15 to 20 small topics just to go through this. Is it necessary to read all the bacteria? Is it necessary to read all the viruses? Like that. Okay. With this, I'll go to the past previous year questions. You may laugh after seeing the previous year question. Or that much easy these questions. The same question coming in the exam, it is difficult because exam pressure, tension, everything. First question. Anaphylaxis is mediated by hypersensitivity reaction. Anaphylaxis belongs to type 1 hypersensitivity. Type 1 hypersensitivity mediated by IgE. Mediated by IgE. Okay. That's all. Very good. Nikesh. Next is rheumatoid factor targets. Rheumatoid factor. It's rheumatoid arthritis. It is autoimmune disorder. Antibody produced against our own antibody. IgM produced against our own IgG. It usually targets FC portion of IgG. That means we are getting some question from immunology, especially hypersensitivity reactions, autoimmunity, antibodies. See, these are all past questions, 2024 questions. Toxic shock syndrome caused by. No need to think second thought. Lovely question. Toxic shock syndrome caused by toxic shock syndrome toxin. TSST by Staphylococcus. Staphylococcus. Streptolysin O. Streptococcus pyogenes. Botulinum toxin by Clostridium botulinum. Diphtheria toxin by Corynebacterium diphtheria. So the take home message, you people should know the toxins as well as mechanism of action. That is important. You should know the mechanism of action of all the available toxins. Mechanism of action of toxins. You must know. Mechanism of action of the toxin you must know. Got it? Mechanism of action. Next is vancomycin resistant enterococci carries which gene? If you see my notes, it's there in the notes. I told enterococci 5 points, 1 point is this point. It carry a gene called VAN-A gene. Vancomycin resistant is due to VAN-A gene. VAN-A gene. Okay. MEC-A gene for methicillin resistant. This is beta lactamase. ERM-B, little tough question, but remember streptogrammin. Like every question spend 1 minute. Like in exam you cannot spend more than that. Hepatitis B surface antigen is a marker. Surface antigen is a marker for active infection as well as carrier state. Immunity is surface antibody. Surface antibody is immunity. Post infection is core antibody, IgG. Just to recollect the panels. Recovery state, where you can get core antibody as well as surface antibody. Got it? So hepatitis B surface antigen is a marker of active infection as well as carrier state also, simple carriers. Next is herpes simplex virus establishes latency in simplex virus 1 above the waist face and herpes simplex 2 below the waist. So herpes simplex 1 is trigeminal ganglion. Herpes simplex 2 is below the waist, genitals, sacral glands. Trigeminal, sacral. Very good. Dr. Deepa, Dr. Nikesh, Dr. Bhavana, beautifully answering. Good. So it usually targets trigeminal ganglion. These are all the questions previously they asked. Some of them I put the year in the bracket. Pseudohyphae seen in. Pseudohyphae present in Candida albicans. Constricted, gem tube, pseudohyphae, all are features of this thing. Aspergillus septate hyphae. Cryptococcus is capsulated yeast. Mucor aseptate hyphae. Okay, aseptate hyphae. Next is India ink stain. Already wherever India ink comes, first you think of Cryptococcus. For diagnosing Cryptococcus neoformans, it is a negative stain. Cryptococcus neoformans is a negative stain. Diagnosis of this one. Got it? Next is Kala-Azar. Direct question, my dears. Kala-Azar. black disease. Cause are caused by Leishmania donovani. Plasmodium vivax causes malaria. Trypanosoma cruzi causes Chagas disease. Can you remember? Chagas disease. Chagas disease. Enterobizoletica causes bacillary dysentery. Bacillary dysentery. Sorry, not bacillary, slip of the tongue. Amoebic dysentery. I'm sorry, amoebic dysentery. Amoebic dysentery. So you should know about the pathogen and the important diseases. And hypnozoites are seen in another MCQ from malaria. Hypnozoites seen in two people, Plasmodium vivax and Plasmodium ovale. Because of hypnozoites, they causes relapse. Relapse is due to hypnozoites. Vivax and ovale. Relapse is due to hypnozoites. Vivax and ovale. See 2023 question. Which method not suitable for sterilizing heat sensitive materials like endodontic files? Heat sensitive material should not use heat. That's all. You should not use, which is not suitable, is autoclaving, because glutaraldehyde, ethylene oxide, gamma radiation, all are called cold sterilization. All are called cold sterilization. We call it as cold sterilization. Glutaraldehyde, ethylene oxide, gamma, there is no heat production. There is no heat production. Great. Next is prion disease are resistant to sterilization because prion disease are resistant to sterilization. What is prion? Prion is a protein, misfolded protein. Actually, the lack of nucleic acid, yes, that's not a correct point. Points are correct, but they never produce biofilm, endotoxin and all. Resistant to sterilization because they have a protein coat, misfolded protein coat. They have misfolded protein coat. Next is, we are getting questions on sterilization disinfection. We got a question hepatitis, we got question parasites, we got question sterilization and disinfection. Okay, right. See here. The minimum exposure time for hot air oven is 170 degree for 1 hour. 15 minutes 120 is autoclave. Same hot air oven 180 degree for 30 minutes. Got it? Next is PSGN, post streptococcal glomerular nephritis, caused by. It is a sequelae of streptococcus infection. M protein mainly M49, M51, 53, those kind of people. M protein, sequelae, consequences of streptococcal infection, especially skin lesions, leads to PSGN, post streptococcal glomerular nephritis. Which virus is DNA virus? All hepatitis viruses are RNA viruses. Live direct question. All are RNA viruses except hepatitis B, which is DNA virus, partial double stranded DNA. Partial double stranded DNA. All other people are RNA viruses. All other people are RNA virus. Beautiful you're answering. Same speed you need to answer. The same speed you need to answer in the main test. That's all. Same confidence and speed. Next is oral candidiasis in HIV patients. Most common candidiasis caused by candida in HIV positive patients. Overall, most common is candida albicans. Even we are classifying the candida into two. One is candida albicans, all other people candida non-albicans. Candida albicans is common cause of oral candidiasis in HIV positive people. Now, just is an analysis, the data which I got. How many questions comes from microbiology, sir? Is it necessary to concentrate microbiology? How many questions is coming? From 2017 onwards, we had analysis. See here. In 2017 and 18, we got 5 questions, micro questions, 5. It's okay, not much significant. Whole microbiology, only 5 questions comes. 2 to 3 questions, general questions, 2 questions may be tough. Then 2020, 21, 22 time, 7 to 8 questions are coming. 7 to 8 questions, significant. 7 to 8 questions are coming. It is significant. 2023, 9 question. 2024, 10 question, 9 to 10 question. 2023 and 24, 9 to 10 questions came. Very significant. Very significant. So slowly it is increasing. Slowly, 7 years before only 5 questions. Now double the amount, 10 questions. Like money doubling. Every 7 to 8 years money become double if you put it in the bank. Same way. 2017, if you're writing entrance exam, 5 questions from micro. So, whatever we learned from the past, now I am going to the predictor series. I will give 2 things. Few example MCQs, model MCQs, and very, very important, what are the topics you need to read? 1 slide, sufficient. I will give it as a PDF. This all you will get a PDF. Don't worry. Okay, see here, ready to answer? Predictor series, yes. Just 40 questions. Shoot, fast. Which of the following method best suited for sterilization of disposable plastic syringe? Disposable plastic syringe, you cannot go for boiling, autoclave or dry heat, hot air oven, because what happens? Everything get melted. So disposable plastic syringe we can go for gamma rays or ethylene oxide. Gamma rays is best, ethylene oxide also good. You can go for ethylene oxide or gamma rays. Very good. Very good, Nikesh. Next is, which chemical disinfectant acts by denaturing proteins and disrupting cell membranes and effective against both bacteria and enveloped viruses? One disinfect main function is disruption of cell membrane and protein denaturation. Protein denaturation by alcohol. Alcohol is against few bacteria and all enveloped viruses because lipid solvent. Isopropyl alcohol. Isopropyl alcohol. Isopropyl alcohol. Next is transfer of plasmid from one bacteria to another bacteria, gene transfer via pilus. That's all. This is the bacteria, this is another bacteria via pilus. What is it called? Conjugation. Excellent. Beautifully people answered. Conjugation. Because transduction via bacteriophage, transformation, direct uptake of naked DNA, conjugation. Very good, very good. So we are getting some questions. I am expecting some question from sterilization, some question from bacterial genetics. And Okay. Next is PLHV with CD4 count less than 100. Dysphagia, white plaques in esophagus, pseudohyphae. So from the past, you decide pseudohyphae, oral cavity, because you are dentists. Okay, so we need questions related to oral cavity. Lot of questions we are anticipating. So pseudohyphae, most likely prophylaxis is fluconazole. 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 Okay. Got it? Fluconazole. Because acyclovir is antiviral. Cotrimoxazole usually antibacterial, and pneumocystis we can give. Amphotericin B is a backup drug. We won't give as a prophylactic, it's a backup drug. Okay, right. Next is a newborn develops microcephaly, hepatosplenomegaly, periventricular calcification on CT. On CT. Which virus is implicated? Microcephaly, hepatosplenomegaly, periventricular calcification. Always remember cytomegalovirus. Zika virus causes microcephaly. But periventricular calcification is CMV. That is the point. Rubella causes deafness. Deafness, patent ductus arteriosus, congenital cataract, everything it causes. Got it? Cytomegalovirus. A traveler returning from Africa has jaundice, dark urine, elevated, right? This is all hepatitis. IgM HEV is positive. Which statement is true? He is having hepatitis E virus infection. Hepatitis E virus infection. No chronicity. Chronicity seen in hepatitis B, C, D. Vaccine not available for hepatitis E. It is not associated with hepatocellular carcinoma. It associated fulminant hepatic failure in pregnancy. So mode of transmission, fecal-oral route. What is the mode of transmission? Fecal-oral route. Yes, yes, yes. Beautiful, beautiful. Fecal-oral route. Fecal-oral route. Fecal-oral route. Got it? Next is a farmer presents with painless ulcerative nodules along lymphatics. Painless ulcerative nodules along lymphatic. Biopsy shown in the image. What is the biopsy structure, my dears? You may get questions like this. Asteroid bodies. The name is asteroid bodies. Asteroid bodies are diagnostic of sporotrichosis. Asteroid bodies, diagnostic of sporotrichosis. Very good, beautiful. You people beautifully answering. I'm so happy. Okay, I'm so happy. You're beautifully are answering. Good. Next is blastomycosis. You can get a broad-based budding cell. Coccidiospirule with endospore. Histoplasma inside the macrophage yeast cells. Inside the macrophage, you can get yeast cells. Yeast cells inside the macrophage, yeast cells. Next is a leukemic patient on chemotherapy develops sinusitis and blocked necrotic eschar. As a dentist, you can easily tell. Biopsy shows aseptate hyphae with right angle branching. Aseptate hyphae, right angle branching, nasal crest, black discoloration. Who is that? This is mucormycosis. We call it as mucormycosis. 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 Drug of choice for mucormycosis, amphotericin B. Drug of choice is amphotericin B. Very good, very good. Beautifully people answering. I'm so happy. I'm seeing the chat box. You're shooting the answer like anything. Mucormycosis. Malaria patient treated with chloroquine develops recurrent fever after 6 months. Which parasite is responsible? Malaria patient, chloroquine. After 6 months, it relapse. Relapse commonly seen in Plasmodium vivax. Plasmodium ovale also causes relapse. Both are correct. But most common is Plasmodium vivax. Plasmodium vivax. Relapse, close, Plasmodium vivax. Ovale also present. Do not forget. Okay. Among the two choices, I can go best is vivax due to hypnozoites. Remember the same question came in previous year questions. So I took previous year questions as a template. I made some questions. A patient with bloody diarrhea, no fever, has oval cyst with 4 nuclei in stool. Okay. Bloody diarrhea and oval with 4 nuclei. Entamoeba histolytica. Entamoeba histolytica. Treatment is metronidazole. Go for metronidazole. Any intestinal, or you can go for metronidazole. Intestinal protozoa, common drug is metronidazole. Endoscopes are best sterilized by? Good question. It will confuse you. Endoscopes are best sterilized by? Not autoclave, not UV rays. Everybody think glutaraldehyde 6-7 years before. Glutaraldehyde was good. We call it as 2% side X. But now the ultimate one is orthophthaldehyde 0.55%. 0.55%. Among the two, this is good. Among the two, this one is good. Got it? Orthophthaldehyde also there, glutaraldehyde is also there. If both are there, you need to go for orthophthaldehyde because that is the best one. Because the question is which is best sterilized by? Which is best sterilized by? Next is a burn patient develops greenish blue pus. Burns patient, greenish blue pus. Culture shows oxidase positive, gram negative bacilli. What pigment is produced? First you tell what is the organism. Burns patient, most common organism. Burns patient, most common organism is Pseudomonas. Burns patient, most common organism is Pseudomonas aeruginosa. Okay, Pseudomonas aeruginosa. It produces all pigments, many pigments. Pyocyanin, bluish green, greenish blue. Pyoverdin, yellow pigment. Pyorubin, red pigment. Pyomelanin, pyomelanin, black to brown pigment. Black to brown pigment. Okay, black to brown pigment. Got it? Right. These are all the pigments produced by Pseudomonas. Prodigiosin produced by Serratia, red color pigment. Melanin is a virulent factor for cryptococcus. Cryptococcus. Okay. Got it? Right. Next is a 35-year-old man presents with painless ulcer on genitals. Painless ulcer on genitals, one and only fellow, mainly, is syphilis. Second is Klebsiella granulomatis, but syphilis. Dark field microscopy from ulcer reveals motile spirochete. Motile spirochete, game over. It is nothing but syphilis. Caused by Trypanosoma pallidum. Syphilis by Trypanosoma pallidum. Syphilis by Trypanosoma pallidum. Treatment penicillin, benzathine penicillin. Very good. Treatment penicillin. Treatment penicillin. Yes, Neha. Next is a child presents with fever, rash, Koplik spot. What else you want? Koplik spot, unvaccinated. What is the virus causes Koplik spot? The oral cavity. See, many questions from oral cavity made. Where you can get Forchheimer spot. Forchheimer spot. Rubella. Rubella, Forchheimer spot. Measles, Koplik spot. The oral cavity. The oral cavity. Where you can get Nagayama spot. Today only I posted. See, today only I have posted in my group. Yeah, today only I have posted Nagayama. See, Nagayama seen in roseola. My group I have posted. Koplik spot. This is Koplik spot. Forchheimer spot and Nagayama spot in the oral cavity. Measles, Koplik spot. Rubella, Forchheimer spot. Roseola, Nagayama spot. Remember, this is available in my Telegram group. You people are aware of that. Microbe magics. Next is, yes, you are right, Maheshwari, you're right. A dental abscess, again, all dental related. See the beauty. Dental abscess culture grows gram-positive branching filaments rods, non-acid fast. So gram-positive filamentous bacteria. Two people, actinomyces, nocardia. Common is actinomyces because it's seen in oral cavity. Actinomyces is non-acid fast. Actinomyces is non-acid fast. Nocardia acid fast. Nocardia acid fast. So here it is not acid fast. I can go for actinomyces. Actinomyces. Okay, actinomyces. Got it? Next is a woman presents with foul smelling vaginal discharge. Vaginal discharge, 3 people. Clue cells, Gardnerella vaginalis, bacterial vaginosis. Pseudohyphae candida. Motile protozoa, trichomonas. Remember, make it very simple. So, woman presents with foul smelling, green vaginal discharge, wet mouth shows motile flagellated protozoa. What is the causative agent? Is trichomonas vaginalis. Because candida albicans, pseudohyphae. Sorry. and Gardnerella vaginalis, clue cells. Neisseria gonorrhoeae, gram-negative diplococci. Gram-negative diplococci. Neisseria gonorrhoeae, gram-negative diplococci. Next is a 24-year-old man with fever and hematuria. Fever, hematuria. After Africa return, have Stuffner's dot in RBC. Tough question. Sometimes you may get tough. The dots you should know. Vivox possess Stuffner dots. Where falciparum produces Mayurer dot. At least these two dots you should know. Stuffner's dot and Mayurer dot. Stuffner and Mayurer dot. Vivox is Stuffner dot. Vivox is Stuffner dot. Okay. Next is a 60-year-old diabetic presents with block nasal discharge. A 60-year-old diabetic presents with block nasal discharge, facial swelling, orbital pain, aseptate hyphae. You finish the file, my dears. Game over. KOH mind, KOH mount, broad aseptate, facial swelling, nasal crust, mucormycosis. They are very good. 18C answered mucormycosis. Beautiful. That's all. A 5-year-old child develops fever, sore throat, grayish pseudomembrane over tonsils. Again, your area. Oral cavity. Okay. Pseudomembranous tonsillitis. Caused by Corynebacterium diphtheriae. And another thing, it grows on low flux medium. That's all. Pseudomembrane, first clue. Low flux medium, second clue. You can go for diphtheria toxin. Diphtheria toxin. Make things easy. Make things simple. Diphtheria toxin. A patient presents with nausea, vomiting and flaccid paralysis after eating canned food. Remember, canned food. That's the clue. Botulinum toxin. Canned food, botulinum toxin. Canned food, botulinum toxin. Canned food, botulinum toxin. It inhibits the release of acetylcholine. Clostridium botulinum, flaccid paralysis. Tetany, spastic paralysis. Tetany, spastic paralysis. Next is a HIV positive patient presents with multiple ring enhancing lesions on the brain. Ring enhancing lesion in the brain. Always remember, toxoplasma is the common. After that, you can go for tuberculosis or progressive multifocal leukoencephalopathy. Many are there. Common multiple ring enhancing lesion. You can go for this thing. Okay. Next is a 6-year-old present with diarrhea after drinking contaminated water. Cyst and trophozoite forms seen in stool microscopy. Organism is 6-year-old presents with diarrhea after drinking contaminated water. Cyst and trophozoite seen in the stool microscopy. Organism is. Please remember, it's a little tough question. But age is 6 years. You are able to see cyst and trophozoite. What is the organism? I won't say it's Balantidium coli because Balantidium coli causes bloody diarrhea. Entamoeba histolytica causes bloody diarrhea, bloody dysentery. Cryptosporidium seen in immunocompromised HIV positives, immunocompromised. Okay, Giardia lamblia. I can go for diarrhea, Giardia lamblia. Superficially, if you see, the question will confuse you. Entamoeba Balantidium causes ciliary dysentery. Entamoeba causes amoebic dysentery. Cryptosporidium commonly seen in HIV positives. With this, all this point, you can go to Giardia lamblia. Next is a man bitten by a dog presents after 10 days with fever, hydrophobia. Which test confirm diagnosis? It is hydrophobia. Confusion is rabies. Rabies incubation period may be weeks. Sometimes it may happen in days also, depending upon the site, everything. Nigri body is a good one. Many people think Nigri bodies. But Nigri bodies present only 80% people. It is absent in 20%. No culture usually. Wilflix disease for rickettsia. Best is RT-PCR. Go for RT-PCR. That is the trap. You need to practice like this. Nigri is a good test. I will not say no, but it is not 100% foolproof. It is absent in 20% people Nigri bodies. So I can go for RT-PCR is the superior test. Nowadays the best test is RT-PCR. That is the best test. Got it? Right. Next is we need to change the decision. Nothing wrong in it. Do 100 mistakes here. Not a single mistake in the exam. That's all. A patient with recurrent oral thrush, esophageal candidiasis. Again, oral thrush, esophageal candidiasis. What is the CD4 count? Usually where the CD4 count is less than 200, you can get oral thrush everything. Okay, oral thrush everything. Okay, right. Less than 200. Which of the infection safety pin appearance in bipolar stain? General question. Safety pin appearance always seen Yersinia pestis, plague. Apart from that, Burkholderia pseudomallei. One more is called Haemophilus ducreyi, Passerella, many things. Many people are safety pin appearance. Next is women develops urinary tract infection. Culture shows gram-negative lactose fermenting bacteria. UTI most common is E. coli. Okay, most common is E. coli. Gram-negative lactose fermenter is Proteus also causes UTI. Klebsiella causes UTI. Pseudomonas causes UTI. E. coli. Among the four, I will remove these two people, Proteus and Pseudomonas, non-lactose fermenter. Klebsiella E. coli or lactose fermenter, but most common cause of UTI is E. coli. Beautifully people answered. Okay, good. E. coli. Even Klebsiella also causes. It is a lactose fermenter, but most common is E. coli. A case of acute flaccid paralysis is confirmed by PCR, stool showing an RNA enterovirus likely cause. Flaccid paralysis, RNA enterovirus. is poliovirus. Poliovirus causes flaccid paralysis. All are enterovirus. Coxsackie causes hand, foot, mouth disease. Rhinovirus causes respiratory infections. Okay, right. Next is a gardener develops slowly progressing subcutaneous swelling with multiple sinuses and grinds. So after seeing the gardener, immediately mind will go to sporothrix. Usually, Dr. Surya kept a trap to you. Gardener means people immediately think of rose gardener's disease, sporothrix. Like that, see, already people answered. No, be careful. Multiple sinus and grinds, discharge granules. So it's a triad of tumor, sinus, granules. Tumor, sinus and granules is nothing but mycetoma. It is nothing but mycetoma. Mycetoma commonly caused by Majorella mycetomatis. Even though these people causes, but they produce yellow granules. Most common in the sense here I can go for Majorella mycetomatis. Majorella mycetomatis. Even actinomyces also causes. I will not say no. Multiple sinus, grinds, subcutaneous swelling, slowly progressive. That is the key point for fungus, because bacteria rapid, slowly progressive is a very good clue. I can go for Majorella. I can go to Majorella. Got it? Answer is D. Next is a hospitalized patient on broad spectrum antibiotic develops diarrhea. Keep on asking the question. You are in hospital. You are giving antibiotic to the patient. Patient develops diarrhea. That is called, and you are seeing toxin A and B. You are seeing toxin A and B. What is it? Condition called antibiotic associated pseudomembranous enterocolitis. Antibiotic associated pseudomembranous enterocolitis. Beautifully people answered. Caused by Clostridioides difficile. That's all. Clostridioides difficile. Make it easy. Next is a man with painless genital ulcer followed by painful inguinal lymphadenopathy. That is the clue. Everybody immediately what thought? Painless means immediately people thought it is trypanosoma pallidum. Trypanosoma pallidum. Everybody will think trap is there. The question is painful inguinal lymphadenopathy. Inguinal lymphadenopathy is classical picture of bubo, chlamydia trachomatis. It's called bubo. The condition is called lymphogranuloma venereum. Lymphogranuloma venereum. Lymphogranuloma venereum. Okay. Next is a patient develops pneumonia after exposed to air conditioning. That's a clue. After air conditioner, they develop pneumonia. Usually it won't take gram stain, it take dietary stain, urinary antigen positive. Little tough question, but the organism is Legionella pneumophila. Atypical pneumonia from air conditioner. Atypical pneumonia from air conditioners. Atypical pneumonia from air conditioners. Got it? Klebsiella gram negative. Chlamydia psittaci causes parrot fever. Most common cause of atypical pneumonia, Mycoplasma pneumoniae. It produces fried egg colony. Learn some points about it. That's all. Next is a baby with cataract, deafness and patent ductus arteriosus. Already I told you. Okay, it is a triad of CCC, cardiac defect, patent ductus arteriosus, cochlear defect, deafness, sensory neuronal, deafness, hearing loss, and congenital cataract. Is feature of, already people answered. What is it? 32. Very good. Shooting. Bhavana, Nikesh, great. Rubella. Congenital rubella syndrome. Congenital rubella syndrome. Next is India Inc. preparation of CSF shows encapsulated yeast cell. People, no second thought. Capsulated yeast cell, budding yeast cell with capsule. India Inc. Meningitis. What else you want, my dears? What else you want? 33. Yes, it is Cryptococcus neoformans. Cryptococcus neoformans. Candida produces pseudohyphae. Candida produces pseudohyphae. Histoplasma capsulatum. Inside the macrophage yeast. Aspergillus septate hyphae. Aspergillus septate hyphae. Like this. 45-degree angle branching. You may get a doubt. Sir will finish by 8 o'clock. He started sharply at 7 o'clock. He said 8 o'clock, 9 o'clock class will be over. Yes. Neonate develops sepsis. Neonatal sepsis. Gram-positive cocaine chains. Streptococcus. CAMP test positive. Over. CAMP test positive. Gram-positive cocaine chains. Neonatal is Streptococcus agalactiae. It is otherwise called Group B Streptococcus. It is otherwise called Group B Streptococcus. Group B Streptococcus. Got it? Very good. Group B Streptococcus. Staphylococcus aureus gram-positive cocci cluster. Streptococcus also chains, but CAMP test negative. Next is a medical student develops fever and jaundice after a needle prick. Surface antigen is positive. Which antigen confirms infectivity? Infectivity decided by envelope antigen. Envelope antigen, high infectivity. High infectivity. Surface antigen, presence of infection. Surface antibody, immunity. Envelope antibody, low infectivity. Envelope antigen, high infectivity. Envelope antibody, low infectivity. A man presents with corneal ulcer, trauma with vegetative matter. Sabrot shows septate hyphae with acute angle branching. Even if you don't know anything, septate hyphae with V-shaped branching, already told, it is Aspergillus. Because corneal ulcer caused by anti-corruption force. Aspergillus, Candida, and Fusarium. And Fusarium. Aspergillus, Candida, Fusarium. ACF, anti-corruption force. I gave the mnemonic, my mnemonic. Fusarium also causes, but Fusarium, it is like this, sickle shaped. Septate hyphae, acute angle branching. Close the file. Next is patient with fever, headache and petechial rash. Petechial rash commonly seen in meningococcal meningitis. fever, headache. Gram negative diplococci. No second thought, I can vote for Neisseria meningitidis. Neisseria meningitidis. Because streptococcus is gram positive. Haemophilus influenzae gram negative bacilli. Listeria gram positive bacilli. So these two are gram positive. So gram negative cocci is Neisseria meningitidis. Next is a diabetic patient with foot ulcer showing foul smelling discharge, crepitus gas formation, gas gangrene. On X-ray reveals large gram. On X-ray, gram stain reveals gram positive rod. What is the agent? Gas gangrene, gram positive bacilli. Gram positive bacilli. Go for Clostridium puffingens. No doubt on it. Clostridium puffingens, gas gangrene. After reading the question, immediately the diagnosis should come. Go to the answer. A post-surgical patient develops fever, hypotension, diffuse erythematous rash. Blood culture shows gram positive cocci cluster. Coagulase positive. Gram positive cocci cluster, coagulase positive is Staphylococcus aureus. Staphylococcus aureus, hypotension, rash called sunburn rash. Sunburn rash caused by toxic shock syndrome toxin. 39 answer is toxic shock syndrome toxin. Beautiful. Lost man. A 5-year-old child, paroxysmal coughing and lymphocytosis. Which media should be used? This is sometimes rarely they may ask. You need to know the selective mediums. Bordetella. Bordetella pertussis. You can go for Regan-Loewy agar. BG medium or Regan-Loewy agar. Okay. With this we completed predictors. What are the prediction? Possible prediction. You people beautifully answered. I think you already predicted. And only one slide. What to read, sir? Last minute glance. You please read. I will send it as to you in the group itself. I'll post. Today itself you'll get it in the group, this image. You need to know all toxins, mechanism action, bioterrorism agents, selective medium list, biosafety levels, vectors and diseases, vaccine strains, parasitology eggs, drug of choice for parasites, and mainly malaria, microfilaria, coccidian parasites, bacteria, not all bacteria, few, E. coli, staph, strep, anthrax, atypical mycobacterium, diphtheria, those people, hypersensitivity reaction, antigen antibody reaction, diseases, know about meningitis, pneumonia, diarrhea, sterilization procedure, like that. Some 25 topics I made. Read all the 25, even mycetoma, candida, systemic mycosis, aspergillus, cryptococcus, mucor, all. 30 to 40 topics are there. Maximum I made all questions from each topic. You go and read this. You will score 100% in microbiology. I will give the guarantee. Read all. Read all. Got it? Hope you all enjoyed. You all enjoyed this Predator series. Hope it is useful to you. 1 hour. I try to do my level best to cover all the topics. Okay. Not explain something very in detail. That is seen in the notes. No problem. But because the time to revise. Now the time is exactly 8:59. Time to say thanks and good night to my kids. Take care. Any doubt, you put it in the group. I'm ready to answer. Okay. Keep in touch with me. God bless you. Kaposi Sorko